I would like for you to imagine what your life might look like if you didn't know how to converse with others. Conversational skills are essential to accessing many great parts of life. Think about your most meaningful relationships. Now, how would these relationships be affected if you couldn't navigate through a conversation? That is, talking about your conversation partner's interests as well as your own. Noticing body language that suggests they are interested in certain topics but not in others. Or letting the person finish speaking prior to you speaking. Not being able to have competent conversations may seriously interfere with making and maintaining meaningful friendships. Let's think about one more area of your life, like your profession. How would conversation difficulties affect you at your job? Think about your interview and your day-to-day interactions with coworkers. Knowing how to have a conversation is the foundation for many of the things that we enjoy in life. Individuals with developmental disabilities often don't know how to make and maintain friendships. Individuals with deficits with staying on topic and being able to appropriately initiate interactions with others have been reported as less likable by their peers. Individuals who notice they have fewer friends and fewer social gatherings experience more loneliness and report more depressive symptoms than neurotypical peers. The first step in the process of improving greeting and conversations is to identify which skills would be most beneficial to teach. Lynn Turkstra and collaborators provided a good starting point with their descriptive data of how neurotypical adolescents converse. They learned that, on average, both adolescents spoke about the same amount of time. Conversations included asking questions, but only for 16% of the opportunities. In addition, the conversation partner made comments related to the previous topic of conversation about 86% of the time. When listening, eye gaze towards the conversation partner occurred about 69% of the time. The researchers also determined what conversation partners don't do. For instance, individuals rarely, that is less than 3% of the time, repeat verbatim the previous statement of the conversation partner, and they rarely complete the conversation partner sentence. These findings suggest some of the skills that individuals should and should not engage in during a conversation. We also need to know, in general, whether individuals with ASD engage in similar conversational behaviors as neurotypical individuals. Lisa Capps and colleagues directly compared the conversational skills of 15 individuals with ASD to 15 neurotypical individuals by arranging semi-structured conversations, which were 6 minutes with an experimenter as the conversation partner who was naive to the individual's diagnostic status. From these conversations, the researchers learned that children with ASD were less likely to continue a reciprocal exchange. They were equally likely to answer questions, but the quality of the answer differed. Children with ASD provided more concrete, direct answers, whereas neurotypical children provided more extensive detail about the activities they partook in and the interactions that they had with friends. For example, when asked, "What do you do when you're not in school?" a child with ASD responded, "Stay at home sick," instead of talking about activities outside of the school hours. In addition, individuals with ASD were more likely to give acontextual statements. For example, during a discussion of after-school activities, a child with ASD stated, "Saber-toothed tigers cannot fly." The goal is to help individuals that want to have better interactions with others contact more social reinforcement and less inadvertent social punishment. These data give us a starting point to consider what conversational aspects may be important to refine. The purpose of the present study was to extend previous literature on improving conversation and greeting skills by synthesizing skills into a more thorough intervention process. We sought to assess generalization across several unfamiliar individuals and maintenance over a 1 to 3 month period. In addition, we sought to assess participants' social acceptability of the teaching procedures and the participants' and parents' rating of their satisfaction of the improved outcomes. The participants in the present study were 3 students, all in mainstream education, that met or exceeded grade expectations. The 2 older students were preparing to apply to college. The first step in assessing social skill concerns, particular to conversation and greeting skills, was to cull the literature for target skills. Next, we conducted a semi-structured interview. We met with the parents and the participants to learn about the participants' interests, strengths, and areas of concern.
Maya, are you interested in meeting others and developing friends?
Yeah, but I don't know how. People at school don't really talk to me, and I get really nervous talking to people I don't know.
Does Maya pick up when someone's no longer interested in a topic or when someone wants to end a conversation?
No, she really struggles with this. She'll talk about her paintings forever, and you can see that people are getting frustrated, but she really doesn't notice, and she'll just keep going.
The interview is particularly helpful to identify idiosyncratic concerns. In addition, this information helped to guide particular areas of conversation and planning for the participants' breaks. Last, we conducted a direct assessment and measured social skills strengths and weaknesses. On a subsequent day, a novel therapist walked up to the participant and their parents to assess the participant's greeting skills. Here, the therapist looks at the participant and her mother and smiles and waits for her to respond. After about 20 seconds, the therapist initiates a brief interaction and then directs her to come into the room for a conversation skills assessment. Here we evaluate if the participant gave a salutation, introduced herself, shook the professional's hand, smiled, asked and answered questions, and said something about herself, such as, "I'm a sophomore in high school," and then gave a closing salutation. We then had a conversation between two therapists and the participant. Throughout the assessment, the conversation was not scripted. Each conversation partner could bring up topics they wished to discuss. For example, at times, the conversation partner would appear uninterested or bored with the topic of conversation to determine if the participant could pick up on the change in body language and change the topic of conversation to re-engage the conversation partner.
So after a conversation with you and after a skills assessment, we believe that Maya could work on accepting compliments, talking about topics that may not be of interest to her but interest to her conversation partners, changing the topic when someone's no longer interested in the conversation, greeting skills, and also lowering distracting movements for conversation partners. Does this sound like a good action plan for you both?
Yes.
Yeah.
Great. Maya, are these some skills that you would like to work on with us?
Yeah.
Is there anything else that you would like Maya to improve on?
No.
Conversations were 10 minutes for Mike and Maggie and 5 minutes for Chris. Throughout the study, conversations occurred with the trainer. This is the only individual who taught the skills. 2 adults also conversed with all participants, but they were never associated with teaching, so that stimulus generalization could be assessed. For Chris, we also had a peer come and converse with him to assess if the skills would transfer to a conversation with somebody similar to his age. Similar to the assessment, the conversations were not scripted, but throughout the conversation partner programmed evocative situations so the participant had the opportunity to engage in the corresponding social skill. In the far left-hand column, we have the evocative situations. The middle column represents the target response, and the far right column denotes which skill each participant was taught. When the conversation partner was bored, by, for example, looking at their watch or their phone or had long pauses without responding, the participant had to change the topic of conversation through a statement or by asking a question. When the conversation partner changed the topic of conversation, the participant had to follow the conversation by making 2 comments in a back and forth manner. Chris's mother also requested help teaching Chris how to clarify unclear statements instead of rudely saying, "Say." So we taught Chris to say things like, "What did you say?" Or "Can you say that again?" Throughout the conversation, we measured distracting nonvocal behavior, such as laying on the table, holding their hands on their face, playing with toys or things on the table, or arm movements that did not match what was being discussed. We also taught Mike to wait for a natural pause prior to speaking. When we had given them a compliment, we taught them to say thank you. And for Maggie, we taught her also to smile because it was one clear time for her to work on her affect. The greeting skills we taught Mike were standing up, shaking the adult's hand, and telling them something about himself, and also to stay standing up straight during the greeting. We programmed 2 of each of the conversation evocative situation and 1 of each of the greeting evocative situations for Mike, and 3 for both Maggie and Chris. I'm going to take you through the methods and the context of the graphs. To remind you, Mike was 16 years old and we targeted both conversation and greeting skills. I'm going to begin by showing you the conversation skills. For this and subsequent graphs, we have shifting the conversation in the top 2 panels. For each pair of panels, there is an arrow on the y-axis to indicate the desirable direction of change. Saying thank you in the 3rd and 4th panel, interrupting in the 5th and 6th panels, distracting nonvocal behavior in the 7th and 8th panels, all across sessions. These figures correspond to figure 1 in the manuscript. For each of the pair of panels, the top panel denotes responding with the trainer, which is represented by the closed circle. The bottom panel denotes responding with the novel adults, denoted by the open symbol. During baseline NCR refers to the intersession break. Between each conversation, Mike had a 5-minute break where he played Xbox with one of the researchers. It is important to note that for Mike, there were no program consequences during his session. In addition, no feedback was given on correct or incorrect responses. Here is an example of what baseline looked like.
Thinking of getting out this weekend.
It's gonna be hot this weekend.
Yeah, so I'm thinking of maybe leaving the valley and headed towards the beach. I'm just not sure what beach yet.
Ugh, I hate Santa Monica.
I do too. It's always so crowded, but it's such a good place for people watching. But I'm thinking of heading towards maybe Manhattan or Hermosa Beach area. I'm not sure yet. So what are your thoughts on Prince?
I don't really care.
Man, really? He's such a legend. I love his music.
Isn't he dead?
Yeah, but man, his music, it just lives on.
Notice the amount of distracting nonvocal behavior, the lack of following the conversation to new topics, interruptions, and the lack of responding to the body language indicating that the conversation partner is uninterested or bored in the topic of conversation. In baseline, we observed low levels of shifting the conversation when the conversation partner was bored, saying thank you following receiving a compliment, and moderate levels of interruptions, and high but variable levels of distracting nonvocal behavior. Next, we taught these skills using behavioral skills training. First, we provided the instructions and a rationale for each of the social skills. Then the trainer and another adult modeled both examples and non-examples of each skill. We programmed non-examples of the specific errors that the participant was making in baseline. Following a correct response, the conversation continued. Following an incorrect response, the conversation partner held up a textual prompt that told the participant the behavior they should engage in. In this example, hands down. Following each modeled example, we asked the participant to describe how the adult did. We did this to increase the participant's attending to the relevant stimuli. In this example, the participant said, "You had to hold up the sign because she was laying on her arm. She needs to sit up and put her hands down." Following correct descriptions, we provided praise and instructional feedback. Following incorrect descriptions, we provided a correct description of the adult's response. Next, the participant practiced the skills in short conversations. Following mastery of these skills in the mini conversations, we returned to the 10-minute conversation with the textual prompts in place. Our first question of interest was, did Mike learn these conversation skills? Here we observed an increase in shifting the conversation and saying thank you, and a decrease in interrupting and distracting nonvocal behavior. Here is an example of what post-teaching looked like. Pay attention to her body orientation and posture, and the lack of distracting nonvocal behavior, how she shifts the conversation during an index of boredom to her vacation to Arizona, and the overall flow of the conversation.
So what kind of job do you want to get?
I don't really know. Maybe something working with computers?
Oh, that sounds great. I hear those are well-paying jobs and they're stable.
Yeah. I have to go in the car ride for a couple days.
Oh, wow. What are you doing?
I'm going to visit my grandparents in Arizona. Me, my mom, my dad, my sister are all going. But me and my mom are going in a different car, which I'm really excited about because I don't have to drive with my sister the whole way down.
Oh, I bet. How many times do you think she's going to ask, "Are we there yet?" My sister used to drive me nuts on car rides.
Our next question of interest was, did these effects generalize to the conversations with novel adults? Remember, these adults were never associated with our teaching conditions. Here we observed similar levels of responding with novel adult 1 and 2. Note that for novel adult 1, the baseline levels of responding for interrupting and distracting nonvocal behavior were low, thus we could not evaluate the effects. In addition, we assessed if the participants could engage in these conversation skills with somebody new that they've never met before in a different environment, a conference room. And in this conversation, might continue to perform at expected levels. Next, I'm going to show you the data for teaching greeting skills. Here we have the percent of self-statements, handshakes, and inappropriate posture in the top, middle, and bottom pairs of panels, respectively. We taught these skills similar to conversation skills. Specifically, the greeting skills that we focused on were during initial greetings with new professionals. Mike was getting ready for job interviews in college and thus wanted to work on professional greetings. Following behavioral skills training, we observed an increase in both self-statements and handshakes. However, we noticed after teaching Mike these skills, he began engaging in inappropriate postures while standing. We subsequently taught him to stand up nice and straight throughout the entire greeting. And then we observed a decrease in the inappropriate postures. All greeting skills were acquired with the trainer. And we subsequently observed stimulus generalization during greetings with novel adults 3, 4, and 5. Desirable levels of responding continued for 1 to 3 months without teaching in place. For the sake of time, I'm not going to take you through the session-by-session data for Maggie and Chris. This graph corresponds to figure 4 in the manuscript. On the y-axis is the mean percentage for the last 3 sessions of evocative situations or sessions all across skills. Pre-teaching performance is denoted by the open symbol, and post-teaching performance is denoted by the closed symbol. Responding with the trainer is denoted by the square, novel adults 1, 2 by the circle, and novel adult 3 or the peer by the triangle. We see an increase in responding during post-teaching for shifting the conversation and saying thank you. That is, we see the data path grow from baseline to post-teaching. Also, we observed a decrease in interrupting and distracting nonvocal behavior for the conversation skills, and an increase for self-statements and handshakes, and a decrease in inappropriate posture for the greeting skills. For Maggie, we observed an increase in responding across shifting the conversation, following the conversation, saying thank you, and smiling, and a decrease in distracting nonvocal behavior with the trainer and novel adults. For Chris, we observed an increase in shifting the conversation, following the conversation, clarifying statements, and a decrease in distracting nonvocal behavior. For Maggie, we observed initial decreases in distracting nonvocal behavior, but these effects did not maintain. In addition, for one novel adult for following the conversation for Maggie and clarifying statements for Chris, we observed generalization, but not at mastery levels. Next, we assessed the participants' and caregivers' satisfaction. First, we asked the participants to provide their satisfaction with their social skills on a Likert scale, with 1 denoting strongly disagree and 7 denoting strongly agree. The first column represents the questions we asked the participants, and the right column represents the ratings for Mike during post-teaching, Maggie during pre- and post-teaching, and Chris during post-teaching. All participants reported being satisfied with their social skills during post-teaching. For Maggie, she rated her satisfaction during both pre- and post-teaching at a 5. Maggie and Mike both reported not knowing that they were doing things wrong during pre-teaching. This may be one of the things that contributed to Maggie's ratings. Mike provided a rating of 4 for being comfortable and noted that he would like to get more real-world practice. We asked each participant's caregiver to watch representative videos of both pre- and post-teaching without being told which videos corresponded to each condition. Following watching the videos, the caregiver was asked to rate their child's overall social skills and then watch additional videos with the instructions to watch for the specific skills that we taught and then again rate the social skills. The overall ratings increased from an average of 2.4 in pre-teaching to 6 in post-teaching. So to summarize, we identified relevant skills. All participants acquired and maintained these skills without continued feedback. All participants were able to engage in these skills with different adults, and we observed high levels of social acceptability. The applied endpoint is when individuals can converse fluently with a variety of different individuals who all behave slightly differently in a variety of different contexts. This is a lofty goal, and I'm going to leave you with some thoughts that I have of areas in need of additional research. We developed a semi-structured direct assessment that allowed us to observe deficits and undesirable behaviors that may have gone unnoticed or not reported by the parents and the participants. We need to continue to refine our assessment to guide clinicians in selecting the most relevant goals for individuals. We need to first obtain additional descriptive research related to how individuals converse, and then second, we need to evaluate the optimal level for these various skills. That is, with social behavior, we are not looking for behaviors to occur all of the time or none of the time. We don't know the desirable level for some of these skills. For example, we know that asking questions is important. It communicates to the conversation partner that we are interested in learning from them and shows that we are actively listening and contributing to the conversation. Likely, this has reinforcing properties. But when the number of questions becomes unpleasant during a conversation, it crosses a barrier and becomes aversive or feels more like an interrogation. It is unknown at what level this occurs, and thus it needs to be determined. Furthermore, what are the cues that conversation partners engage in to communicate this level of aversiveness? We also need to learn how the types of conversational skills change when somebody has repeated interactions with another person. Essentially, how do initial and subsequent conversations lead to a friendship? As Shasta Nelson puts it, how do we teach individuals to develop frientimacy? That is, relationships where both people feel seen in a safe and satisfying way. We need additional research to evaluate social behaviors and how these behaviors may vary across cultures. We need to make sure that we are teaching a culturally sensitive repertoire of conversational skills. We also need to evaluate under what conditions particular social behaviors are best taught with trained clinicians or amongst a peer group of individuals who are also working on their social behaviors. For Maggie and Chris, naturally occurring reinforcers within the conversation were not sufficient to produce desirable changes in the target skills. We used delayed contingent breaks with activities for both Maggie and Chris. And we also delivered tokens for immediate consequences with Chris. We need additional research on programming for maintenance when the natural social consequences do not influence the individual's behavior. We need additional research on conditioning these natural consequences to become reinforcers and punishers. In addition to asking the participants and the caregivers to provide their ratings of social acceptability, we should be asking individuals who just interacted with a client how they rate the interaction. That is, rather than watching a video, asking people who just experienced an interaction if they would like to interact again in the future. That's the ultimate test of social acceptability for conversation skills.